Medical revalidation of Puerto Rico. Clinical vignette on Piperacillin plus Tazobactam. Shiksit clinical vignette. A 65-year-old man with a history of type 2 diabetes mellitus, hypertension, and chronic kidney disease is admitted to the hospital for fever, chills, and right-sided flank pain. He reports a 2-day history of dysuria, frequency, and hematuria, which progressed to fever 39.2 degrees Celsius per 102.5 hours, and costovertebral angle tenderness. Vitals. Blood pressure 98-60 millimeter, heart rate 112 BPM, temperature 39.2 degree to 1, respiratory rate 18 min, labs, WBC 18,000 millimetio, serum creatinine 2.1 milligram deo from baseline 1.2 milligram deo, urinalysis plus leukocyte esterase plus nitrites, WBC casts, blood cultures pending, urine cultures pending, diagnosis. The patient is diagnosed with complicated pyelonephritis with suspected urosepsis. Question: which of the following is the most appropriate initial antibiotic therapy for this patient? A. Ceftriaxone. B. Ciprofloxacin. C. Piperacillin tazobactam. D. Trimethoprim sulfamethoxazole. TMX. Answer: C. Piperacillin tazobactam. This patient has complicated pyelonephritis with suspected sepsis, requiring broad-spectrum intravenous antibiotics that cover gram-negative bacteria, including Pseudomonas aeruginosa, extended-spectrum beta-lactamase, ESBL organisms, Enterobacteriaceae, E. coli, Klebsiella proteus. Piperacillin tazobactam is an extended-spectrum penicillin plus beta-lactamase inhibitor combination that provides excellent coverage against Pseudomonas aeruginosa, gram-negative bacilli, Enterobacteriaceae, including ESBL-producing bacteria, gram-positive cocci, Streptococcus enterococcus, anaerobes, Bacteroides, Clostridium spp. Why is this the best choice? Covers both common uropathogens and resistant organisms. Effective in critically ill patients with sepsis. Preferred in renal impairment, dose adjusted. Why not the other options? A. Ceftriaxone. Great for community-acquired pyelonephritis, but no Pseudomonas coverage, not first line for septic patients with possible drug-resistant organisms. B. Ciprofloxacin. Fluoroquinolones are effective but not preferred for severely ill septic patients. Increasing resistance in E. coli strains limits use. D. Trimethoprim sulfamethoxazole, TMP-SMX, used for uncomplicated UTIs, but not adequate for severe pyelonephritis or sepsis. No Pseudomonas coverage. Next step in management: start EV Piperacillin tazobactam immediately. Monitor blood cultures and adjust antibiotics if needed. Fluids, blood pressure support for sepsis. Consider ICU admission if signs of worsening shock.